Welcome, my friends, to the Bob and Brad Show. My name is Mike Keenitz. I'm a PT assistant, and
I'm Bob Shrub,
today we
physical therapist.
have world-renowned physical therapist Rick Olderman on, and he's going to evaluate and determine what is causing my lateral hip pain. So if you're having some hip pain, you might want to stay tuned.
What is lateral?
Lateral, outside.
Outside, right.
Oh, sorry.
Rick is a master clinician. He's the best of the best.
And he did quite a job because he already did it. We're recording this later, so stay tuned.
Bob and Brad, the two most famous physical therapists on the internet.
Okay, so Mike, tell me. Let's start off with you telling me what your problem is. Other than Bob.
Well, there's Brad too. I get some lateral hip discomfort. It's kind of lateral. It's kind of hip flexor. This whole left side gets bothersome. It's more bothersome evening time, like after I run. If I take time away from running and just lift, it doesn't really bother me that much. When I'm busy doing stuff standing, don't even notice it. It's when I'm laying in bed on that side, sitting for too long is when I notice it more.
Are you experiencing any semblance of that pain or discomfort right now?
A little bit, just because I'm sitting. But
if you lie on your left side, would you feel it?
Yeah, I can't really sleep on my left side right now.
So ultimately, we got to get you back to sleeping on your side or stomach, right?
Yeah, I'd like to fall asleep on my sides again, and
okay.
Sometimes it happens, sometimes it doesn't.
So let's go ahead. First of all, I just want you to lie on your left side, and I want you to get a bead on how much pain or discomfort you're having just lying on that now. Is it already uncomfortable?
Yeah, I can feel it.
Okay. And the longer you stay here, does it become worse?
Yeah.
So we're going to try one simple thing. This isn't going to solve anything, but it's going to help take some pressure off of that. So do you guys have a bed pillow in there?
Yeah.
Right. So what we're going to do is we're going to put one of those pillows underneath your trunk.
Under my trunk. Okay.
So it's yeah, just like that, and then lay back down. All right. So first of all, I want to see how much relief you get just by having a pillow weight bearing more through your rib cage. This should take some of it off of your hip. Does that help at all in terms of point contact stress?
A little, but I think this pillow is just super flat. Like if I fold it, and it's bigger, it does.
Okay, so you can play around with maybe a pillow thickness. What I'm thinking about right off the bat is we got to get you sleeping better, right?
Yeah.
And if you can sleep on your left side like this, if that's how you prefer to sleep, then what we're doing is unloading the contact stress on that injured hip, so that you can sleep. Okay. Now keep that pillow there for a second. What I'd like you to do with that second pillow is you're going to put it underneath your bottom ankle. Yeah. So what this is doing now, it's rotating the hip joint in the socket a little bit into some external rotation.
Sure.
And do you like that or not like that?
No, I like that. I've never thought about putting the pillow there. I've always done it like between the knees, but more, when I'm on my other side. But
being a male, and I'm going to test this, but I'm going to guess that you have some degree of retroversion in your femur.
Yes.
Yeah.
And so what we're doing is we're taking the stress, the internal rotation stress off that hip joint and aligning the femur into external rotation so you can sleep better. Okay, so this is something that you can play with tonight and see if you can sleep better. All right, so the next thing I'd like you to do, let's see. Mike, do you have a chair or stool that's lower than that table that you can sit on?
Yeah, grab one quick.
So what I want you to do is scoot forward to the edge of that chair. Do you think you can do a single leg stand out of this chair, Mike?
Yeah.
Okay, so what I want you to do is lift one of your feet, and then you're going to do 10 single leg stands, standing up and sitting down with the 1 foot up in the air. Let's see it. 10 on one side, 10 on the other.
9.
Ew.
10.
All right, switch.
1, 10.
All right, Mike, which one was harder?
I don't know. I guess it left a little bit, but I'm right dominant.
Yeah. So this is the interesting thing, is that you're right dominant and you're injured on your left, but you chose to do it on your left leg first.
Yeah.
Most people would choose their non-painful leg to do first,
Oh.
unless there was a problem with that leg.
I just chose the weak side first, I guess.
I'm not sure. But it doesn't test weaker, though. And when I watch you do it on your right side, I see your right knee moving a lot more than your left did.
That's what he was saying when I walked.
Yeah.
So I'm suspecting a compensation, especially as you're training and we get endurance. I mean, this is only 10 reps. If I asked you to do 100 reps, I wonder what would be the difference,
Yeah,
you
get
know?
more shaky.
Yeah.
So there was more trunk and knee compensation on that right side. So I'm suspecting a compensation pattern for your right leg right off the bat here. Mike, you remember that thigh stretch that I have in the program? I'm not sure if you looked at the program yet. All right, so lie back on the table with your knee, most of your thigh off the edge, lie back, knees to chest. Put a pillow underneath your head.
Just whacks me with the pillow.
There you go.
Knees to chest.
Both?
Yeah. All right, so hug that. That should feel comfortable for you.
Yeah.
So just lower one of your legs down, holding the other knee to your chest. Keeping the knee bent at 90 degrees. So bend your knee about 10 to 20 more degrees.
The left one?
Yeah, the left one. There, that's
wow.
90 degrees.
Wow.
All right.
That's tight.
Man.
All right, so there's that one. Bring that back up. Oh, so Bob, go ahead and lower that back. I'm sorry. Let's go ahead and switch to the right one first. Then I'll ask you. I don't want you to change anything. All right. Do you feel a difference between the two legs in terms of tightness there, Mike?
Yeah. I mean, I feel more in the hip on my left one. This one, getting a cramp in my hammy.
Yeah.
I feel fine like this, but once I bend it back, I feel it in my hamstring a lot.
Right. Because you're working against a tight thigh muscle, right?
Yeah.
Okay. So it doesn't seem like there's a huge difference, but you're tight enough that I would ask you to do this. And when you do this, I'd like that knee to be in line with the hip joint. So, instead of to the outside.
Yeah.
Because I was out here more.
Right.
Okay. Does
that make sense?
It's like quivering now.
Yeah. Because you're working pretty hard against those tight thigh muscles, but also by bringing the knee to the inside, we're also stretching your IT band.
Oh, okay.
All right. And that tensor fasciae lata. All right. So that would be my first exercise for you. So now, Mike, we're going to ask you to roll over in your tummy. All right. So Bob, you're going to put your hands on his butt muscles.
Oh yeah, that one.
Let's first just do the two butt muscles, one hand on each. And then Mike, you're going to do a straight leg raise on the left. And Bob, you're going to notice the timing of the glute activation.
Again, down, up.
So I never do the same leg twice in a row.
Oh, sure.
Because after he lowers it, it's still on now.
Sure.
So then we switch legs.
Go back and forth, Mike.
There you go. Yeah, just like that. That'll give you a truer sense.
Again.
They both seem to be activating the same degree and the same time.
No, left not as much.
Left not as much. Okay. Yep. What percent less would you say, Bob?
I'd say 25% less.
Okay, that's significant. And Mike, do you feel a difference between the two?
I can't tell on my butt.
Okay.
I mean, my left hip feels tighter in the front when I kick back.
Yeah, that makes sense. Okay. So now, Mike, you're going to get up onto your elbows and knees. And you remember that butt pump exercise I do?
Talking about like a...
Yeah, just like that. So I want you to do 30 reps on one side, Mike.
30?
Yes.
How far?
Watch for the shelf band.
How far down do I have to go?
I do not want the butt to turn off. So you're going to want to stay up at the top somewhere, like a little pulse, like a ½ inch up and down. Good.
This?
Yep. Now your hip does not have to go into extension does it have to go all the way up there to turn on, or can you do it lower? There you go. Somewhere around there. And even that's too big because your butt's probably turning off at the bottom of that range. There you go. Now, Mike, I want you to sense whether you feel your butt muscle working.
I feel hamstrings more.
Yes, that's what it looks like to me. And it looks like you're pushing up with your quads.
Probably.
All
I feel
right.
like I'm very quad and hamstring dominant.
Yes. Yeah. All right. Let's switch. Does it feel the same on the left as the right?
Yeah. I mean, I don't feel much.
They're not superstars either way, are they?
No.
All right. So hold that right there. Now, I want you to externally rotate your left knee maybe 5 degrees. So your left foot will come in towards midline and your knee will move out just a little bit. And now start pumping again. And you should feel more butt muscle activated now. So ultimately, we need to be able to do this exercise with your leg not rotated.
Okay.
Because then when it's in a neutral position, that's the position it's in when you're running.
Sure.
But right now, it's not turning on very well. And you have to do all of this contortion to get it to turn on. So I'm going to ask you to do this exercise probably for 2 sets. And since you're a marathon runner, I'm going to ask you to eventually build up to 20 pounds behind each leg.
Oh, jeez.
Wow.
All right. Because we need to ensure that the butt is not the culprit here. All right. Now, sitting there, what I'd like you to do is I'd like you to rotate your left foot to the outside. So the lower leg is rotating to the outside like a windshield wiper. There we go. And I want you to remain weight bearing on the left hip, though.
You want me to?
Oh, weight bear on the left hip while rotating it out to the outside.
Left hip.
Oh, don't lift.
There we go. Okay, now rotate it to the inside. Okay, one more time to the outside. Okay, now let's see the right one. Rotate that to the outside. Rotate to the inside. Rotate to the outside. I mean, we can check for more anteversion and retroversion, but this is looking like you've got 2 retroverted femurs to me.
Right.
Yeah.
Right? You guys in agreement with that?
Yep.
Okay.
Yeah.
Totally.
All right. So we've got 2 externally rotated femurs. But however, when I see you standing and do your leg squats on your chair, your feet were not externally rotated.
Yeah.
They were facing forward.
Yep.
Okay. So we need to align the feet just like your daughter, Bob.
All right.
We need to align the feet
Yep.
with the rotation of the femur. What that means, Mike, go ahead and stand up. All right. Now they're slightly externally rotated. All right. So normally when you first initially stood there, they were not. So go ahead and face them forward. And you can feel the tension in your lower leg muscles trying to do that versus when they're pointed out a little bit.
Yeah.
Go ahead and
Feel it.
got it?
Yeah.
Exactly. So this is how I'm going to ask you to stand and walk for the next week or so. You're going to be turning your feet out a little bit.
Okay.
And I'm not going to ask you to run like this because but I want you to pay attention to your running to see if your feet are rotated out a little bit when you're running.
Sure.
I don't want you to change anything. I always get nervous changing running habits.
Yeah.
And we walk much longer. We spend more time standing and walking during the day than we do running. So let's fix the daytime walking pattern and see if that translates into the running. Does it look like, Bob, his knees are locked?
They were.
Yes.
Yeah, we talked about before.
Yeah. I'm pretty guilty of that.
So do you guys have Leukotape P or cover roll stretch tape?
Do. Right.
All right, let's tape the backs of Mike's knees after today.
Sure.
And get him to stop locking his knees because we found that your glutes, Mike, are not ideal. And locking the knees is turning those off during the day.
Yeah.
Yeah.
So so we need that little reminder while we're really drilling down into this problem for you. Okay. So, and then you'll notice, Mike, that when you turn your feet out, it's easier to keep your knees unlocked.
Yeah. I'm just This seems weird.
Yeah.
I'm so used to, because I do have a standing desk that can stand and sit at home, and I'm so used to just being straightforward. I guess I don't think about it, and then I lock my knees. Yeah, well, this is. I don't like sitting a whole lot because after a while my hip feels like it's getting tight. So
the next thing I want to look at here is, do you guys have a little exercise tube in there, like a light one or a medium one?
Yeah.
Yeah.
Okay, so we've got that tube now. I'm going to ask you to grab both handles and stand on the tube with both feet.
That's all you get.
I'd like the tube to be closer to the heel and, on your arch, but closer to the heel.
Okay.
All right. So what we're going to do is we're going to unlock you're going to pick a leg to stand on, and you're going to unlock that knee and lift up the other foot about a ½ inch off the ground. And go ahead and bring that foot out to the side, about 6 inches, and then back in. You're going to do 15 reps of that. So left knee should be soft. And we want your trunk to be lined up over the left leg. See that?
I feel like I'm leaning.
You're exactly right.
So
Keep going. 15 reps. You're going too far out. You don't have to go that far.
Okay.
15.
That's good. Switch legs. Look at the difference.
Yeah, bend your knee too. Right.
But Mike, look where your trunk is on your right side versus your left.
Is it more straight?
Yes.
I'm kind of small on the screen, so I'm trying to.
Yeah. You're small on my screen too. So. Okay. Now, Bob, Mike, you're going to turn with your back towards Bob. You're going to do it again, standing on your left leg. And Bob, I want you to keep your hands on his pelvis. Go ahead, Mike. And Bob, what you're going to pay attention to is how much that pelvis is lifting on the opposite side. So he's standing on his left, and we're paying attention to the right pelvis elevation.
Well, the first time with the left, I was kicking up high.
Oh,
yeah.
Now he's up an inch.
So keep it closer to the ground and straight.
Yes. Yeah. 6 inches. That's all you need to go. So Bob, is one side elevating more than the other side?
The right side.
The right side's elevating more when he's standing on his left, you're saying?
The left side is elevating more when he stands on his right side.
Oh, okay. Got it. So this is giving, so what are we looking at here? So yeah. So when we do this exercise, the pelvis shouldn't, in fact, do a few reps without any resistance at all, Mike. And Bob, put your hands on his hips.
Yeah, not lifting at all.
Yeah, you see that? Now let's do it on the other leg, Mike.
Yep.
Okay, so that's what should be happening even with resistance.
Okay.
So when the opposite hip is elevating, for instance, when you're standing on your left leg and your right hip is elevating up, what's happening is that you're using your right waist muscles to help the left abductors work.
Sure.
Because your foot has to get off the ground, and your left abductors are controlling the tilt of the pelvis. And what's happening is they're not able to control the tilt of the pelvis, so you're pulling in your right waist muscles to do that for you. This is also why you're leaning so far to the left, because your hip can't stabilize that whole system with any resistance. It needs all the help it can get, so you lean, and then you use the right waist muscles to help pull the right hip up to do the job of the left abductors. Does that make sense?
Yep.
Yeah.
And then when you stand on your right side, not nearly as much lean, just a little bit, and the pelvis stays more level on the left side, because your right hip can do that work. I would agree with you, the left side is weaker, for sure, with the abductors. All right? So it could be that they're weaker because the gluteus maximus isn't helping. So we're going to get the gluteus maximus turned on, get the gluteus medius to work better, and see if this takes the pressure off that tensor fasciae lata pain that you're having. All right. At the same time, you're going to be turning your feet out so that you're not working against the shape of your thigh bones. So my focus for you, because I'm sure your legs are quite strong, but your butt muscles don't seem to be turning on and helping, right? Yeah. And those hip abductors have an asymmetrical strength. So we're going to create symmetry there, get the butt to start participating. The runner's lunge and the Neanderthal lunge are designed to force that butt to participate.
Neanderthal.
All right.
Right up your alley.
So that's why I like those for you.